Hi, I'm Dr. Mary Gardner with Lap of Love Veterinary Hospice. The question that I get asked most is, how will I know when it's time to say goodbye to my pet? And this all comes down to evaluating their quality of life, but that's not necessarily easy. So there are a couple of factors that I look at when helping families assess their pet's quality of life, and I hope they can help you as well. So the first is, what are the ailments that the pet is experiencing? So are they nauseous? Are they not eating? Are they not sleeping through the night? Are they limping? Are they super itchy? Are they anxious? The list goes on and on. And so I want to write down with the family all of those ailments that the pet is struggling with, and kind of looking at the severity of each one, and also which ones will really affect their quality of life. And for me, the worst ailment to have is the inability to breathe. And so if your pet has heart disease, collapsing trachea, maybe pneumonia, something that prevents them from breathing or breathing well or having increased effort, that is the worst type of ailment to have. And so those are going to change my quality of life discussions. We're going to talk about the emergency clinic, because when your pet is in a respiratory event where they can't breathe well, you're going to be rushing them to the emergency clinic. And so writing down all the ailments from everyone's perspective is the first step. The next factor I look at is your pet's personality and how they are managing these ailments. There are some pets that get very anxious if they've had an accident in the house. And there's other pets, my dog Sam, she would have fecal incontinence and just walk away, like, go clean that up. And so how are they managing their symptoms? How are they managing their treatments? Are they taking their medications? Are you able to bring them to physical therapy? Are you able to bring them to your veterinarian to get seen? Are they unable to get in the car? Are they anxious in the veterinary clinic? Are they now anxious around other pets? So every pet has a beautiful personality and they're all different. And so we want to make sure that your pet is still happy dealing with all their ailments and the treatments that they may be receiving. The next factor is the family's budgets. And there are a couple of budgets to think about. First is the monetary budget. There are some treatments that may cost a lot of money, thousands of dollars. And then there's others that are maybe, $10, $20, $30, $50 a month. But everybody's monetary budget is different and what you're able to afford. And also the size of the pet may play a factor into this. A smaller dog usually costs less money for food and medications versus a Great Dane. So that is the first budget I'm going to look at. The second budget is the physical budget. How are you, as a pet owner, able to physically help your pet? We often think about larger dogs with arthritis, but even a 20-pound dog with arthritis can be difficult to manage. Are you having to clean up after them because they're having a lot of accidents around the house? Are you able to do that? Are you able to physically give them subcutaneous fluids? Are you able to actually give them the medications? And people struggle with the physical aspects of caring for a pet. The next budget is the time budget. Do you have the time? And, be easy on yourself if this budget is up for you, because on average, it takes about 3 hours a day to care for a geriatric or terminally ill pet, whether it's preparing their medication or reordering their medication or getting their food or taking a much slower walk around the block or cleaning up the urine or the vomit that may have happened. And so it takes a lot of time to manage these pets. And if you're at work for 8 hours plus commute, plus, going to do your normal day-to-day things, you're not able to come home for 12 hours, your pet may need extra care during that day and you're unable to provide it. And then the last budget is the emotional budget. Are you emotionally handling caring for your pet okay? And there's something called caregiver burden, and I want you all to understand that that's a thing, that it takes an emotional toll on us. We're worried about the day to say goodbye. We're worried about others in the house. We're worried about people coming in from out of town. We're worried about our pets suffering. We're excited because we had a good day, but then tomorrow's a bad day. And one thing while I'm on this subject, don't mistake a good moment for a good day. And so that emotional budget can be actually the one that's taxed the most. So at any time, if any one of those 4 budgets are up for my family, I support their decision to say goodbye. So if they can't monetarily, physically, time-wise, or emotionally care for their pet the way that their pet needs, then I support their decision to say goodbye. So these budgets are different for all of us. Now, considering all these factors is one thing, but you may need some additional help when looking at those factors. And so that is why I love the quality of life scales available. And at Lap of Love, we have one available on our website that helps guide you through some of these questions. And you'll give a numeric score. Sometimes it's really helpful to write a diary every single day and maybe also write down what a score is for certain categories. And then at the end of every week, tally up the scores that you're giving your pet. And after you've reached a certain mark, maybe end of life is actually the best option. So just know that this decision is not an easy one. It is not just when they stop eating or when they can't get up, because there are some pets that will eat until their very last day and actually enjoy a pizza or a hot dog on their last day. So you can't always just use one measurement when assessing the quality of life of your pet. So just remember and recap the ailments that they're managing, and you as well, their personality, and all of those budgets. And combined together, you will come up with the best options for your pet. If you need any assistance, please know that at Lap of Love, we also do telehospice, so you can speak directly with one of our veterinarians to help you assess quality of life of your pet.